Symptoms, management, and natural remedies for pneumonia. Pneumonia is one of the most serious lung infections affecting millions of people every year. It can strike anyone, from young children to the elderly, and often develops quickly if ignored. Recognizing the signs early, knowing how to manage it, and using the right remedies can make all the difference between a fast recovery and dangerous complications. This guide breaks down everything you need to know in a simple, practical way. 1. Understanding what pneumonia really is. Pneumonia is an infection that inflames the tiny air sacs in the lungs, known as alveoli. These sacs may fill with fluid or pus, making it difficult for oxygen to move freely into the bloodstream. This is why people with pneumonia often feel short of breath and fatigued. It can be caused by bacteria, viruses, or fungi, with bacterial pneumonia being the most severe form. Understanding its nature is the first step to tackling it, because pneumonia isn't just a bad cough. It is a condition that requires attention, care, and in many cases, medical treatment. 2. Common symptoms. You should never ignore. The symptoms of pneumonia often start like a cold or flu, but then become much more intense. High fever, chills, and heavy sweating are common. A persistent cough producing yellow, green, or even bloody mucus is another warning sign. Shortness of breath, sharp chest pain while breathing, and rapid heartbeat are also frequent symptoms. Some patients experience fatigue so severe that simple tasks feel exhausting. In older adults, confusion or sudden changes in mental awareness can occur, making it especially dangerous. Recognizing these signals early ensures prompt treatment and faster recovery. 3. The hidden signs of pneumonia in children and elderly. While adults often show strong symptoms, children and the elderly may present pneumonia differently. Babies might breathe rapidly, grunt while exhaling, or refuse to eat. Children may become unusually fussy, tired, or lethargic. In seniors, pneumonia may not always cause a high fever. Sometimes it only appears as weakness, dizziness, or confusion. This makes it harder to spot but more dangerous if overlooked. Caregivers should always be attentive to subtle changes in breathing, energy, or alertness, as pneumonia can escalate quickly in these vulnerable groups. 4. Medical diagnosis and when to see a doctor. Self-diagnosing pneumonia is risky because its symptoms overlap with flu, bronchitis, and even asthma attacks. A doctor usually confirms pneumonia with a chest X-ray, physical examination, and sometimes blood or sputum tests. If you experience persistent cough with mucus, chest pain, or shortness of breath, it's vital to seek medical attention. Ignoring pneumonia can lead to life-threatening complications like sepsis, lung abscess, or pleural effusion. Timely diagnosis means appropriate treatment, whether antibiotics for bacterial infections, antivirals for viral pneumonia, or antifungals in rarer cases. 5. Medical treatments and standard care options. Treatment depends on the cause. Bacterial pneumonia is treated with antibiotics, which usually start working within days. Viral pneumonia often requires supportive care like rest, hydration, and antiviral medication in severe cases. Fungal pneumonia needs specific antifungal drugs. Alongside medication, patients are often advised to get plenty of fluids, use a humidifier, and avoid smoking. In more serious cases, hospitalization with oxygen therapy or intravenous antibiotics may be required. Following a doctor's prescription carefully is crucial, even if symptoms begin to improve early. 6. Home remedies to support recovery. While medical treatment is essential, home remedies can ease discomfort and help recovery. Warm fluids like ginger tea, chicken soup, and herbal infusions soothe the throat and keep the body hydrated. Honey is a natural cough reliever, while steam inhalation helps loosen mucus in the lungs. Garlic, known for its antimicrobial properties, can support the immune system. Adequate rest is one of the most powerful remedies as it allows the body to fight off infection. These supportive steps cannot replace medical care, but work hand in hand with it. 7. Lifestyle adjustments that make healing faster. Recovering from pneumonia doesn't stop at medicine, it requires lifestyle adjustments. Getting enough sleep helps the immune system restore itself. Eating a nutrient-rich diet filled with fruits, vegetables, and protein gives the body strength to fight infection. Avoiding alcohol and smoking is non-negotiable, as they weaken lung function and prolong recovery. Gentle breathing exercises may also help rebuild lung capacity. Even after symptoms fade, it may take weeks for energy levels to return. So pacing yourself and avoiding overexertion is important during healing. 8. Preventive measures to reduce risk of pneumonia. The best way to deal with pneumonia is to prevent it in the first place. Vaccines such as the pneumococcal vaccine and flu shots dramatically reduce risk, especially in the elderly, children, and those with weakened immune systems. In fact, medical experts emphasize that vaccination is one of the strongest defenses against severe lung infections. Practicing good hygiene, like frequent hand washing, sanitizing commonly touched surfaces, and avoiding close contact with sick individuals, lowers the chances of infection spreading. Strengthening the immune system is another key factor. Regular exercise, a balanced diet rich in fruits, vegetables, and lean proteins, along with adequate hydration, keeps the body strong and ready to fight off bacteria and viruses. Quality sleep is equally important since rest helps the immune system recharge. For smokers, quitting smoking is one of the most effective preventive steps, as cigarette smoke damages lung tissue and leaves the respiratory system more vulnerable to infections. 9. Emotional and mental health. During pneumonia recovery, physical illness often takes a toll on mental health, and pneumonia is no exception. Extended periods of weakness, coughing, and limited activity can cause frustration, anxiety, or even depression. Patients may feel discouraged if recovery takes longer than expected, especially when they are unable to return to work, school, or social activities right away. These feelings are normal but need to be addressed. And this is why emotional support from family, friends, and healthcare providers is so vital. Simple encouragement, helping with daily chores, or just being present can boost a patient's morale. Incorporating mindfulness practices like deep breathing, prayer, meditation, or journaling can ease stress and create a sense of control during recovery. Patients are also encouraged to set small, realistic recovery goals, such as walking a little farther each day, to build confidence and track progress. 10. Long-term outlook and life after pneumonia. Most people recover fully from pneumonia, but the recovery timeline can vary depending on age, overall health, and the severity of the infection. Some bounce back in a few weeks, while others, especially older adults or those with pre-existing conditions, may need months to regain full lung strength. It's not uncommon to feel fatigue, weakness, or mild shortness of breath even after the infection clears. To prevent relapse or secondary infections, patients are encouraged to complete all prescribed medications, attend follow-up checkups, and continue lung-strengthening practices like breathing exercises or light physical activity. Drinking plenty of fluids and gradually increasing physical stamina also supports lung recovery. If this video gave you clarity about pneumonia, make sure to like, share, and subscribe for more health and wellness content. Your support helps spread awareness and keeps this channel growing. Have you or someone you know battled pneumonia? Share your experience in the comments. We'd love to hear your story.